Finnegan. I am a visiting scholar at the Hastings Centre. I am a doctor in psychiatry. I've also studied law and ethics. I came to the Hastings Centre for 8 weeks as part of a joint visiting scholarship between Yale and the Hastings Centre. I came on a Fulbright scholarship sponsored by the Health Research Board in Ireland, where I'm from. My research question focused on how to more equitably distribute research participation opportunities to people who are in vulnerable populations, such as people with mental illness, people who are in difficult social circumstances. I came to this research question during the course of my own PhD, in which I was running pilot clinical trials of ketamine for depression. I came to the Hastings Centre with a research proposal for that piece of prospective research, but I also found that during the time that I was here I had opportunities to engage in fields of bioethics that I had very little exposure to previously, meeting colleagues who were involved in anything from animal ethics, environmental ethics, end-of-life care, and so much more. So during the time that I was completing my prospective research study, I also had opportunities to reflect on my clinical practice and on my research practice, and to think very carefully about the norms that were underpinning assumptions that I was making, and aspects of ethics that were influencing my day-to-day clinical practice. If I could think about some of the things that I've learned during the time that I've been here, first of all, I've had a great time. But I have learned to think very carefully about language that I use, and language that we collectively as a profession use, not just in mental health but also in research, and the consequences of the terms that we use for people affected by particular illnesses. I've learned to think very carefully about each word and the consequences arising from use of that word, and that's something that's probably going to be very important to my own clinical practice. Aside from having an opportunity to complete my own research project, I've had a greater opportunity to reflect on aspects of bioethics that I had never considered before.